Let's roll into implants.
Okay.
Share with the viewers, what is an implant?
Well, a dental implant is a way to replace the roots of missing teeth. So when someone has a tooth extracted or is about to have a tooth extracted, there are options in terms of replacing that tooth. And the dental implant is just a titanium post that we place into the bone, and then that is used to support a replacement tooth. It's a long process, but it's worth it.
Right. So what are some of the biggest fears that you hear your patients saying when they come into your practice and they realize they have to have an implant?
Pain. No doubt about it. Pain is the biggest fear. Everyone has questions about pain. How long will I be down? How bad does this hurt? And the answer, surprisingly, is there's very little pain. Actually, removing a tooth is more traumatic. And removing a tooth isn't that big a deal, but it does cause some swelling and minor soreness, and people are on pain medicine for 24 hours or so. An implant's less traumatic, so people are on pain medicine for half a day. It doesn't require the same amount of downtime, which is nice. And a lot of patients come back and years later and get another implant or two. So fortunately, we don't end up hurting our patients, otherwise we never see them again.
Right, right, that's great. So then you just sit with them and you reassure them that this process is going to be maybe much easier than they expect.
Yes, and you can see the relief when you start to explain to them that it isn't that traumatic to have a dental implant placed, and they're really not down for very long, and they come back a week later and say that they still have a full bottle of pain medicine they never ended up using, and it just ends up being a very simple recovery for most people.
That's very encouraging, actually.